What I wanted to cover was just a little bit about what SCIE is. Why on earth would somebody from Social Care Institute for Excellence be coming up and speaking here about this important topic? Wanted to reflect on why information is so important to social care, which clearly you all get anyway because you're here, but actually spend most of the time talking about addressing the information gap, what are the things that are happening at the moment to help us with that, and where you might go in the future. So the Social Care Institute for Excellence is an independent charity. We support improvement in care and support services for everybody involved, for people who are using those services, working in the sector, managing the services or paying for those services. And we do that by sharing the knowledge of what works in co-production with service users and their carers. Everything that we do alongside and with people who will be the ultimate beneficiaries, in partnership with the wider sector to make sure that what we're doing is relevant and responsive to the needs of the sector, and through the delivery of some innovative resources and services. And I will highlight what some of those specific resources are later on in my presentation that are relevant to today's discussion. But I just wanted to kind of remind us what we're doing this for. We're doing all of this because we want to commission and deliver good quality services that are safe, have good outcomes, are effective for people, but also deliver a good experience. And so aspects of what we need to talk about in terms of information need to be thinking about those three key objectives that we've got. So, why is information so important in social care? And I think there are so many reasons why this could be. I could have spent the entire time just talking about this really. But we know that we are supporting people with complex needs. It is older people, for example, are not necessarily just getting older and needing some support. They may have significant issues like dementia or like other physical conditions that they're contending with. They may be isolated and lonely. There are all sorts of things that we need to be thinking about, and so those complex needs require an individual focus to address. And so one of the key messages I think about information is that one size is not going to fit all. So we have to kind of be aware of that. The system that we've developed and that we work in can be incredibly difficult to navigate. And as we know, we keep on changing it. And those of us who work in the system find it blooming difficult to get around. So how does that feel to somebody who for the first time is having to get to grips with it? But we also know how important information is in terms of giving choice and control to people who use services, either through personalisation if they're in receipt of local authority funding, or given that this is a means-tested service if they're funding those services for themselves. And I'd also like to suggest that actually information isn't just important for the people who are using services and their carers, but it's also critically important for all of us who are working in the care and support sector, because that's essential to support a capable and confident workforce who can support people properly. So, I reckon information is power. With good information, people can be aware of the available services, they can make informed choices, they know what to expect, and they have the confidence to challenge when things go wrong. And a handy reference point for everybody, if you've not come across yet, the Making It Real I statement, which were developed with service users and carers about the things that actually matter to them in the way that their services are delivered. And first and foremost, that those service users and carers told us was that they have the information that they need when they need it. Information is power for staff too. They know what good looks like, they can improve their own skills and practice, and they can support users and carers to make informed choices. And they too can challenge when things go wrong with that information behind them. So, where are we now in terms of that's a fantastic objective for us all to have? We know why we want to do it. What's the scorecard in terms of whether we're getting there? We did some work last year when we were launching Find Me Good Care, a website that I'm going to talk about in a few minutes, and spoke to people about their experiences. And there were some pretty shocking figures that came out of that, which have been, other surveys tell us exactly the same thing. 2/3 of people have no idea how much care provision costs, or indeed who pays for it. And it comes to an awful lot of people as a great big shock that this is means tested. Over 2/3 of people leave care decisions until they need to, which means that they are making those decisions in a crisis. And it is so often that when you're making decisions in a crisis, that you'll make the wrong decision, or you'll make a decision that you're not entirely comfortable with in the cold light of day. And so 1/4 of the people that we spoke to said that they felt that they had ended up with inappropriate care. And 50% of people who were thinking about care in the future were not confident that they would know what service would suit their needs. So we know from what people are telling us that they're not really very confident about it. We've done some work with Independent Age and Think Local Act Personal to find out why that might be. And the messages again are very simple. This is complicated stuff and it's difficult to understand, and so we need to make it easier for people. Sometimes, however, we make it so easy, it's simplistic and it's not tailored to individual needs. So we kind of have a sort of feast or famine situation with this sometimes, I think. Very often, the information that we provide is full of jargon, and that, I think, is a real barrier to people's understanding of the information that we're making available. And very often it's not comprehensive, and sometimes people are worried that it's not reliable either. And in terms of where's the scorecard for staff, this is just some of the headlines that keep on coming up in terms of some of the problems that we've got. And I think fundamental to all of these things, like, for example, the report that came from the Care Quality Commission around the Mental Capacity Act not being fully understood by staff, is a lack of information and a lack of support for people around what they should be accessing there. So, we've done some work thinking about how can we address these problems, and a really important area of that was, where do people go to access social care information? And actually what this list tells you again is one size doesn't fit all. If actually your natural inclination is to talk to a friend or to your GP, actually just producing information that's available for local authorities isn't really going to help us. So we need to think about all of these various points that people will access the information. So in terms of addressing that information gap, I think that there are some key messages for us to take away. First of all, we've got to understand the importance of information. And I'm so glad that you've come here this afternoon to hear this talk, because, as I say, it obviously means that you guys get it, but we've got to make sure that that's actually spread beyond this room. We need to involve the people who are using services and their carers in the design of the information that's being provided, because that's the only way that we're going to get over the incomprehensible jargon, the difficulty in making that information appropriate for people. You've heard me say it at least twice already, but one size doesn't fit all. We've got to be thinking about flexible and innovative ways of providing the information. And we need it to be accessible and clear. But we also need to make sure that we're not reinventing the wheel. There's a tremendous amount of good information out there, particularly from third sector organisations who are responding to specific needs that people have. And one of the important things that I think those of us who are working in the service need to do is to make sure we're signposting to those appropriately. So I'm just going to focus on 4 key areas where we're trying to address this information gap and the sorts of things that are happening. From a national perspective, there are three things that I'd sort of point you to. The first is the Care Bill, which is currently going through Parliament at the moment. You can dip into the House of Lords committee stage at the moment if you fancy have a few minutes to watch Parliament TV. But that Care Bill places a duty on local authorities to establish and maintain an information and advice service. Now, that's not going to come into law until next year probably, and be expected and it's not going to be expected until 2015. But I think that gives us a really good direction of travel, that there is going to be that expectation and that duty. There's been a lot of talk recently about how do we know what good looks like, and how do we know that a particular service is any better or worse than the service down the road. And one way that that is going to be addressed is through the expectation that the Care Quality Commission will be rating care providers in the future. And they are currently recruiting a Chief Inspector of Social Care who will actually be leading the piece of work to deliver on that. And finally, NHS Choices, which for those of us who have used it in the past, I used it to diagnose my husband's hernia, and we might have thought that that was just a health content website, but they are now developing their social care content and fundamentally including on it provider quality profiles highlighting specific information from each of the providers. There's an awful lot of information that SCIE is developing to try and support the information needs of both service users and carers, but also staff. And I really would recommend, and I'm going to give the details at the end of where you go to for that, but really recommend that you have a look at our website because there is an awful lot there. But we are very conscious that just putting things out as guides or briefings, just information packs, is not necessarily going to tap into all of the different people that we need to be making that information available to. So one of the things, and I'm standing on the shoulders of giants here, I've only been in this job for a year, so all of this work happened before me, but we've been developing social care TV films, small videos showing good practice, what good looks like, what are the things that actually as a service user we might be expecting, or as a care provider we could be delivering. And we're going to be putting all of that on YouTube and mobile devices in the future. We do have one of our really helpful products is something called the Dementia Gateway, which is focused on supporting people who are working with people living with dementia. And this week, in Carers Week, we've actually launched some new resources that redesign some of that content for carers to make it clear how we can support carers in this really important role. We've got lots of e-learning resources which both staff and service users and carers can use to actually learn about the different things that they could be doing and how they could improve their knowledge. And we're using Twitter and Facebook. I think getting into social media and thinking about how we can tap into that zeitgeist is really important, because the service users and carers of today are not going to be necessarily the service users and carers of tomorrow. And we've got to be thinking about keeping pace with all of that innovation and change. So just a few examples here. We launched earlier this year our adult safeguarding resource, which is an e-learning resource. But for those of us who just want a short introduction to the issues around adult safeguarding, there are a series of vignettes, little films that take you through the journeys and explore some of the issues around adult safeguarding, which I think is really important. And one of the things that we did here was we didn't call it e-learning because I didn't want it to feel like it was restricted to people working in the service. It's actually something that people who are using the service or caring for somebody can use as well. We've done a lot of work on personalisation and launched last year an ability to personalise your own personalisation guide, so identifying the information within that guide that's useful for you. And the Social Care TV, this is just one example around ensuring that people can have good outcomes using trying to address unnecessary hospital admissions and supporting people in their own homes. And remembering that what we're about is not just that it's safe, not just that it's got a good outcome, but actually we're talking about people having a good experience. And having a good experience also means that people spend their time meaningfully and purposefully. And one area that we've looked at is how we can use information and communication technology in activities for people with dementia. And there's a great line in it, which is that older people, particularly with dementia, don't think that iPads are computers, and they're very intuitive, and there's lots of places where people are using those resources to really engage with older people in a very different way. Last year we launched at SCIE Find Me Good Care, a new website designed to actually answer the question that Andrew was talking about earlier in terms of where do you go when you want information about the care and support system. So the core of Find Me Good Care is advice and guidance on services for adults, including things like what to think about before you're looking for care. What are the things that we should be asking about the service and about what's important to us so that we determine, not in a crisis, the only thing that you can do is go into a residential home, but actually what are the options that might enable you to stay at home and to have your quality of life there. We also provide information about how services are paid for. There is a directory of service building on the Care Quality Commission's information. And very importantly, and goes back to the point that I made earlier about not reinventing the wheel and making sure that we're signposting, we do include links to other organisations, including councils and national charities, where they've got the very specific information that might help people with a very particular need. Think Local Act Personal, which I'm a member of the board of Think Local Act Personal, is a partnership of different organisations in the care and support system, linking commissioners, providers, people who are using services and their carers, health and other national organisations. And one of the important work streams in Think Local Act Personal has been the information, advice and brokerage work stream, which I've had the real pleasure of leading. And we are very shortly going to be coming out with some really useful information, which I think I'd really encourage you to get involved in commenting on. Because what we're showing you is work in progress at this stage, because what we want to do is to turn some of this material into much more interactive and useful tools and resources. So the first thing that we've been developing is an interactive map showing how people access the system and where are the information points along that way. So what is it that we need to be doing and what is it that we need to be providing? We've also developed a set of principles for the provision of information and advice, and some of the principles that I talked about earlier about not reinventing the wheel and co-designing with service users and carers are in that set of principles as well. But my personal favourite is the social care jargon buster. We consulted with people and asked folk to say, what is your kind of pet hate in terms of social care jargon, so that we could translate that into everyday language. And we ended up with 52, so one for every week of the year. And what I'd like to be able to do with that is to turn it into a French-English translation dictionary of social care jargon and everyday language, so that actually, in the future, if we get to this, that you could be reading something where somebody says respite care and it almost immediately says, actually what we mean here is having a break, so that actually we can get over that barrier which we know exists for people in the use of jargon. So these are the learning points that I was asked to make sure that I'd covered in my session. I hope that I've been able to bring you up to date with the current developments that we've got around the information field, given you an insight into what the information needs are of people who are using services, carers, but also for staff. Signposted you off to some relevant information resources, which I hope that you will use. And fundamentally, what I hope that you will walk away from this session with is confidence that we can make a difference with information. If you wanted to look at any further information there, all of the websites that I've mentioned, SCIE, Find Me Good Care and Think Local, Act Personal are all there. If you thought that what I was saying was at all interesting, you can also follow me on Twitter at CrouchEndTiger7. Thank you very much.
Thank you very much, Andrea. There's not a session on immediately after this, and we did start a bit late, so there is some time for a few questions for Andrea. If anyone's got a question, do you want to put your hand up, and I'll see if I can get the microphone to you. Okay, hold on. Let me just hop down here.
There is one down here.
Hello, Andrea. My name's Julian Patterson. I'm from NHS Networks. We hear a lot about the need to provide people with information, not reinvent wheels, and not provide more unnecessary complexity to people who are already overwhelmed with complexity. You've just talked about 3 websites. I've got one. I've got 2 or 3 actually. If we went around this building today, we'd find thousands of information resources. How do we cope with that problem that in trying to do good, we're creating a huge number of new roads for people to travel to find the things they need?
Thank you very much. That is an absolutely fantastic question, which also means is code for, and it's incredibly difficult to answer. But I think the reason why I think it's a fantastic question is because you're absolutely right. Everybody is trying to do good in this field. We are trying to address that information gap, and there are different ways of doing it. I think that my answer would be that we have to collaborate across those information resources and recognise that sometimes we're answering different questions that people need. So what we need to be very clear about is what is the kind of purpose of the information that we're providing, what are the things it's going to help people with, and if you need something else, we also ought to be in the kind of, upfront position of saying, and this is where you go off to. So if you go on to, for example, Find Me Good Care, we have a page worth of things that says, well, actually, if you want more information about X, Y, or Z, then here is a mental health charity that actually will give you a lot more information about that particular area, or learning disabilities, or whatever it is. Because ours is a generic, across the board, starter for 10 website, which needs to divert people off. And I think that one of the things that sessions like this can do is actually highlight the need for those of us who are in this field to actually kind of do what we preach and try and make those links together.
Do you have any more questions for
There's one there.
Just over here. If you can say your name, where you're from, and then ask the question.
Hi, good afternoon. My name is Suhaila from Bluebird Care. I was interested in the SCIE resources. Would you please just tell us a little bit about any cost involved for these, getting these guides and these training or e-learning courses, please?
Did you say cost?
Yes.
Yeah. Okay. Our website is free to air, so the resources that are on the website anybody can access. We have been funded over the years by the Department of Health and other organisations to ensure that actually that information is available without barriers. There's additional support that we can provide through training, for example, which would be bespoke and would be paid for, but the resources that are available on the website you are very free to and very much encouraged to use. Thank you. And thank you for giving me the opportunity to clarify that.